Cardiac stress tests are invaluable tools for diagnosing heart conditions by assessing how your heart performs under stress. However, there are situations where these tests could do more harm than good. These situations are called contraindications. Understanding them is crucial to ensuring patient safety. A contraindication is a specific condition where a medical procedure or treatment should be avoided because it might be harmful. In the case of cardiac stress tests, contraindications mean that the test should either not be performed at all or should be done with extreme caution. Contraindications can limit the use of cardiac stress tests in several ways. They can increase the risk of serious adverse events, such as heart attacks or strokes. They can lead to unreliable or misleading test results. They may exacerbate pre-existing conditions. They can cause physical harm or severe discomfort to the patient. One of the biggest concerns with contraindications is the increased risk of serious complications. For example, performing a stress test on a patient who recently had a heart attack could trigger another, possibly fatal, cardiac event. The heart muscle, already damaged, may not handle the extra stress well. Certain contraindications, like severe hypertension, can also make test results difficult to interpret. A patient with very high blood pressure might have an exaggerated response during the test, which can mask the true condition of their heart and lead to incorrect conclusions. In some cases, pre-existing conditions can be worsened by a cardiac stress test. Take severe aortic stenosis, for example. This condition makes it hard for the heart to pump blood efficiently. Stressing the heart further could cause a dangerous drop in blood flow, leading to serious complications. Stress tests can also worsen irregular heart rhythms, known as cardiac arrhythmias. If a patient's heart rhythm is already unstable, the physical exertion from the test could trigger more severe arrhythmias, causing symptoms like dizziness, palpitations, or even loss of consciousness. Let's look at some specific examples of contraindications. Acute myocardial infarction within 2 days. The heart is too compromised to handle additional stress, increasing the risk of another heart attack. Unstable angina. The heart's blood supply is already limited, so adding stress could lead to a full-blown heart attack. Severe aortic stenosis. The heart struggles to push blood through a narrowed valve. Exercise increases this demand, risking heart failure or sudden death. Uncontrolled cardiac arrhythmias. Exercise could exacerbate irregular heartbeats, leading to more dangerous conditions. Severe hypertension, SBP greater than 200 millimeters of mercury. High blood pressure can spike during the test, increasing the risk of stroke. Understanding contraindications to cardiac stress tests is vital for protecting patients from potentially life-threatening complications. Healthcare providers must carefully assess these risks before deciding whether to perform the test or explore alternative diagnostic methods. Patient safety should always come first.